My name is Penny Schofield. I'm 49 years old. I'm the mother of 4 children, and I have twin boys of only 2.5, a daughter of 3 and a son of 11. In June 2011, I discovered I had a lump in my breast. I examined myself and in the shower and discovered a lump in my right breast. I made an appointment to see my GP, and he referred me to the consultant at the hospital.
Penny Schofield was referred to the breast care unit at the Royal Hampshire County Hospital in Winchester, which is one of the leading centres in the UK. Following her initial diagnosis, which indicated ductal carcinoma in situ, a lump was removed during surgery and analysed by the pathology team. This revealed invasive cancer.
Obviously, it was necessary to then proceed to have a mastectomy. And from a personal point of view, I wanted the procedure of a mastectomy and reconstruction to take place as quickly as possible. One of the options that the consultant and the breast nurse offered me was the option of having a surgery which involved the mastectomy, but at that time having the lymph nodes examined whilst I was under general anaesthetic. If the lymph nodes were found to be clear, the consultant could then, or the surgeon could then, proceed with the reconstruction at the same time. This to me was a real benefit because it meant that I would only need one operation. The recovery time would be much quicker, and that myself and my family could move on and put this all behind us.
At Winchester, the option of one-step surgery is possible due to the introduction of an intra-operative service for sentinel lymph node analysis. This offers a real benefit to patients, as Siobhan Laws, surgeon at the hospital, explains.
We've been using the intra-operative sentinel node analysis technique for 2 years now. I'm very happy with the results so far, and so are our patients. We find it particularly useful in all patients who are having sentinel node biopsies, in that we can prevent them coming back for a second axillary clearance. And in general, I would say that my experience with the patients is they found it very, very helpful to have a very early pointer as to where the next treatment is going to go. So, for example, if their nodes are positive and they know they're coming up for chemotherapy, it gives them plenty of time to prepare and think about that before we make the final decision. So they really have been very, very satisfied with that part of the service.
Once the sentinel nodes are removed, they're quickly delivered to the pathology lab. In the meantime, the surgeon can complete the remaining breast surgery. The intra-operative test is done by an innovative technique called Osna. Lymph node tissue is homogenized, and after a short preparation step, the sample is analyzed by a machine. Within 20 minutes, the presence or absence of cancer cells in the lymph node can be verified, and the result is reported immediately to the surgeon in the operating theatre.
We chose to use this particular type of intraoperative sentinel node analysis because it analyses the whole lymph node. That way we get a definitive result at the time of the operation, and we don't have the situation where we tell the patient that the node is negative during the operation, and then unfortunately a piece of the other half of the node turned out to be positive.
In Penny's case, the Osna result was negative, and this allowed the surgeon to proceed with immediate breast reconstruction.
After the surgery, I woke up and my immediate reaction was to feel my right breast, and I could feel that reconstruction had taken place, and it was a great relief to know that. Also, by seeing that the reconstruction had taken place, I had assumed then that my lymph nodes were clear, although obviously I waited for the doctors to confirm that. It certainly helped with the recovery from the anaesthetic. It was a sort of pleasing glow to know that everything had gone well. I didn't need radiotherapy. Obviously I had to have chemotherapy, but a very short course of chemotherapy, only 4 sessions. And that's now been concluded, and I'm back at work and feel that the operation, everything is in the distant past, albeit it was only 6 to 7 months ago.